Hmm?
Hello dear student, in previous class I have told you or I have explained you about a class of drug that was NSAIDs or non-steroidal anti-inflammatory drug that we generally use to treat severe pain, inflammation and other inflammation, so that due to any pain by external damage or internal damage we can control that inflammation and we can reduce that pain, so that we have used NSAIDs or non-steroidal anti-inflammatory drug. In that NSAIDs drugs, same like action is also done in case of anti-rheumatoid drugs, that is the today's topic. But these type of drugs are named as anti-rheumatoid drugs because they are generally intake in our body for a general purpose. That what is that? That kind of drug or that class of drugs we generally intake in our body in term of to overcome arthritis. That is a very common problem in our generation. In generally it is shown in our India most of for the old age or geriatric patient, that arthritis is very common disease or is very common disorder that generally shown into that geriatric person in India in most of the old age people. So in purpose to treat that arthritis, we generally use a drug or class of drug that is in terms of medical or pharmacy term is classified into a class of drug that is anti-rheumatoid drugs. So now first we have to discuss about what is arthritis and why we should have take that anti-rheumatoid drug to treat that disease. So first we will know what is arthritis. आपने अपने आपकी घर में बड़े लोगों को बोलते सुना होगा, उन लोगों को कभी कभी जॉइंट में पेन आता है, दे हैव पेन इन देयर जॉइंट्स, दे ऑलवेज कंप्लेन to the juniors or to their child when some people are getting older and their bone become very weak and they face joint pain and inflammation into their joints like knee joints, in hand, in legs. They generally feel a severe pain that is termed as arthritis. And what is arthritis in medical term? Arthritis in medical term, it is a autoimmune disease. It is a autoimmune disease that leads to the pain and in joint inflammation in joints, and it is mostly shown into the old people or geriatric patient. So that is a very common problem in nowadays because most of the old age people or geriatric person are suffering from that arthritis. So to treat that arthritis or to get relief from that inflammation and pain into the joints, there are some class of drugs that we are generally in our daily life that are called anti-rheumatoid drugs. So it was the definition of arthritis and what is anti-rheumatoid drug and why we have to take this in our body because of treating that arthritis or pain and inflammation into the joints. Now we will go to into the classification of anti-rheumatoid drugs. Here we will discuss about different classes of drugs that comes under anti-rheumatoid drugs which are used to treat arthritis in old age people. In general, that anti-rheumatoid drugs are classified in different classification according to their action and how they are going to show their action. That means mechanism of action. The first class of classification is drug modifying anti-rheumatoid disease. So in that we can classify or sub-classify that drug into the two parts. One is non-biological and another one is biological. In non-biological, what are the example we can study or we can use as anti-rheumatoid drugs? First one is methotrexate. Second one, what we can use, that is sulfasalazine. Sulfasalazine. And third drug that can be also used as non-biological drug for anti-rheumatoid, that is chloroquine or hydroxychloroquine, that you have already studied, I think, or heard about in your 11-12 classes, that chloroquines are also used to treat malaria. So that chloroquine can usually be as anti-rheumatoid drug also, because it has mild anti-inflammatory profile or anti-inflammatory properties. So chloroquine can be used as anti-rheumatoid drugs also, as mild NSAIDs also, but most of the cases chloroquine is used to treat malaria. So these are the examples of non-biological drugs that modifying anti-rheumatoid effect or anti-rheumatoid arthritis. Now we will study about the examples of biological anti-rheumatoid drugs. What are the examples? They can be classified into two parts. One drug that is generally inhibit the production of THF alpha production. So biological drugs example which generally shows their action by inhibiting the production of THF alpha, example is etanercept. Etanercept. And another more example which generally show their action by inhibiting interleukins 1 and 2 production, example is anakinra. So in non-biological we have studied three type of drug. One was methotrexate, sulfasalazine and chloroquine or hydroxychloroquine. But in case of biological drugs we can use drug of etanercept that generally shows their action by inhibiting the production of THF alpha, and another subclassification that is interleukins 1 and 6 inhibitors, example is anakinra. So that was the first classification, drug modifying ARTD or anti-rheumatoid drugs. First one is biological. In biological, THF alpha reduction is in etanercept. IL-1 and 6 inhibitor is anakinra, and non-biological drugs are chloroquine, methotrexate and sulfasalazine. And second type of anti-rheumatoid drugs are adjuvants. In adjuvants, which drugs are there? Generally corticosteroids are there, which generally can be used as the anti-rheumatoid drugs. What is the example? Prednisolone. So this was the classification of adjuvant anti-rheumatoid drugs, where we generally use corticosteroid drugs as anti-rheumatoid drugs. Example, most of the use is prednisolone. So by that I have finished up the classification of anti-rheumatoid drugs. Now we will go in individual drugs and their mechanism of action, by which I will explain how that drug is going to show its action as anti-rheumatoid drugs and used to get relief from arthritis pain. So first drug that we are going to discuss, that is methotrexate. How that methotrexate is going to show their action as anti-rheumatoid drugs? First you have to remember, methotrexate is going to show its action by inhibiting dihydrofolate reductase enzyme. How they are going to show their action? By inhibiting the synthesis of dihydrofolate reductase. For that, first we have to understand why and how that dihydrofolate reductase is going to work as, or what is its main action. The main action of dihydrofolate is to convert into the dihydrofolate to tetrahydrofolate. To conversion from the dihydrofolate to tetrahydrofolate, generally dihydrofolate reductase enzyme generally act as or act on. That conversion from dihydrofolate to tetrahydrofolate is consist or is promote the synthesis of folic acid synthesis. So the conversion from dihydrofolate to tetrahydrofolate will lead to the promotion or synthesis of high quality or high quantity of folic acid synthesis that will lead to the DNA replication and self replication or cell multiplication. So now what that methotrexate will do? That methotrexate will inhibit the action or synthesis of dihydrofolate reductase enzyme. So what it will take place? For that reductase inhibition, the dihydrofolate can't be converted into the tetrahydrofolate. If that dihydrofolate is not promoting or is not synthesized into the tetrahydrofolate or converting, that will lead to the non-synthesis of folic acid, or that folic acid synthesis will reduce highly. Why it will reduce highly? Because that dihydrofolate reductase inhibition is going to disturb or is going to fully cancelize the conversion from dihydrofolate to tetrahydrofolate, leads to the no production of folic acid or less production of folic acid, leads to the inhibition in DNA replication and inhibition in cell replication. So it will lead to the treatment of inflammation. So by that, methotrexate can show its action by inhibiting the action of dihydrofolate reductase and by inhibiting cell synthesis and DNA replication. And sometimes that methotrexate also can induce the synthesis of cytokines, and that reduced synthesis of cytokines leads to the suppression of immunity by inhibiting the production of lymphocyte T and lymphocyte B. Then that is also one of the way how methotrexate is going to act as anti-rheumatoid. How that is going to act as anti-rheumatoid? By inhibiting the synthesis of cytokines leads to the decrease in autoimmunity or immunity system of our body, or suppression of immunity, that leads to the less synthesis of lymphocyte T and lymphocyte B. By that also methotrexate can show its action as anti-rheumatoid drug. So what is the dose of anti-rheumatoid drug that we should consume per day? That rheumatoid drug methotrexate is taken as orally, as oral dose, and this oral dose is very low in dose, that is only 7 to 15 mg per day, and the onset of relieving or inhibition of symptoms in anti-rheumatoid is very less, only 4 to 6 weeks. That means if you are taking methotrexate 7 to 15 mg per day, within 4 to 6 weeks, the symptoms of anti-rheumatoid or arthritis like pain or inflammation in joint will reduce gradually within 6 to 4 weeks if we are taking methotrexate per day 7 to 15 mg who are suffering from arthritis or GOUT. That GOUT I am going to discuss in next. Now we will go to discuss about the drugs of sulfasalazine. Now we are going to discuss about sulfasalazine and how it is going to show its action as anti-rheumatoid drug and going to treat arthritis. When the sulfasalazine is taken into our body, it will go to the metabolism. How it will go into the metabolism? It will go to metabolism by intestinal metabolism. It will going to the intestinal metabolism. When it is going to the intestinal metabolism, it will convert into the 5 amino salicylic acid, or we can call it as 5 asa. Now what that 5 asa will do? Now that 5 asa or 5 amino salicylic acid is going to reduce the production of prostaglandin, THF alpha, and also is going to reduce the synthesis of interleukins 1 and interleukins 6. And that reduction of PGH, THF2 and interleukins 1 and 6 is going to reduce in immunity of our body, and it will lead to the less autoimmunity and treatment of arthritis. And it also inhibits oxidative phosphorylation in inflamed joints. So how that sulfasalazine is going to act as? When that sulfasalazine is going to take orally in our body, it will going through the intestinal metabolism and converted to 5 amino salicylic acid, that is going to decrease the production of PGH, THF alpha, then interleukins 1 and 2, and it also going to reduce the oxidative phosphorylation in inflamed joints, and it leads to the treatment of arthritis. That is how generally sulfasalazine show its action as an anti-rheumatoid drug. The dose of sulfasalazine that is going to consume per day to treat arthritis, that is only 1 to 3 gram per day, with 2 to 3 division of dose per day. So how much sulfasalazine is going to consume for the treatment of anti-rheumatoid or arthritis? 1 to 3 gram per day in 2 to 3 divided doses in a day. That will lead to the treatment of arthritis and relieve the pain or inflammation in joints. The next drug is chloroquine. That chloroquine is generally anti-malarial drug with mild NSAIDs and mild anti-rheumatoid drug property. And how it is going to show their action? It is going to show their action by inhibiting the synthesis of monocytic interleukins 1 and monolytic interleukin 6. By that inhibition of synthesizing monocytic interleukins 1 and 6, it is going to treat arthritis. And this is how chloroquine can be also used as mild anti-rheumatoid drug. What is the drug dose of chloroquine? That is very less, because in general we are not taking chloroquine as anti-rheumatoid drug in our daily life. Mostly it is act as anti-malarial, but for some time when drugs are not there, chloroquine we can be used as anti-rheumatoid, but most of the cases as an anti-rheumatoid drug we generally use methotrexate or prednisolone. That methotrexate work or mechanism I have already explained you in the previous slide. Now I am going to discuss about the another important drug of anti-rheumatoid that is going to treat arthritis, that is prednisolone. First we have to remember prednisolone is a corticosteroid drug and it comes under adjuvant anti-rheumatoid drug. In classification I have already told you prednisolone comes under adjuvant drug and it is comes under the classification of corticosteroid anti-rheumatoid drugs. How that is going to show their action? That is going to show their action by binding with or by forming a complex with intramolecular of intramolecular glucocorticoid receptors. That prednisolone, by binding with intracellular glucocorticoid receptor, it will form a complex, that is prednisolone glucocorticoid complex. That complex, what it will do? That will alter gene transcription. That will alter gene transcription. So how that prednisolone is going to show their action? It is going to show their action by binding with intracellular or intramolecular corticosteroid receptor or glucocorticoid receptor, and by binding a complex it is going to alter the gene transcription. And another more one mechanism of action is prednisolone generally convert into the metabolic system, and by changing its forms it generally can also inhibit the synthesis or action of phospholipase A2. By inhibiting the action of phospholipase A2, it is going to inhibit the synthesis of cytokines, prostaglandins, THF alpha, and also the inhibiting synthesis of interleukins 1 and interleukin 6, and that will lead to the inhibition of immunity system or suppression of immunity system and going to treat arthritis and show its action as anti-rheumatoid drugs. So how that prednisolone is going to show their action? That prednisolone is going to show their action by converting into a complex by binding with intracellular glucocorticoid receptor, that is going to alter the gene transcription. And sometime also that prednisolone can show its action by inhibiting the synthesis of or action of phospholipase A2, that will lead to the decrease in synthesis of cytokines, prostaglandins, THF alpha, interleukins 1 and 6, and it is going to suppress the immunity system, and by that prednisolone can treat arthritis and can be used as anti-rheumatoid drugs. So that methotrexate and prednisolone, that two are the most important drugs or more frequently used in our daily life to treat arthritis as anti-rheumatoid drugs. So that was the simple introduction, a simple explanation about anti-rheumatoid drugs and their classification, and mostly used anti-rheumatoid drugs like methotrexate, sulfasalazine, chloroquine, and corticosteroid prednisolone. Most of the time or infrequently in our daily life, we use methotrexate and prednisolone as anti-rheumatoid drug to treat arthritis in old age or geriatric patient. Now another term that you have to remember or study that is related to arthritis, that is GOUT. What is GOUT? You can tell GOUT is the extension version or severe version of rheumatoid arthritis. So why it is called as GOUT, or why not it is called as rheumatoid arthritis? GOUT is when that rheumatoid arthritis is going into the severe or extreme attack or severe or extreme pain in joints, that is called as GOUT. Why that GOUT is happening? GOUT is happening due to the over accumulation or deposition of monosodium urate crystals due to the over synthesis of uric acid. So what is GOUT? GOUT is the severe or extreme version of rheumatoid arthritis where that patient is feeling severe pain and joint inflammation due to the over accumulation or deposition of monosodium urate crystals into their joints, and due to that joint pain and inflammation is going into that extreme version, and that is more extreme and severe than rheumatoid arthritis, then it is called as GOUT. So GOUT is the severe arthritis where that patient is feeling severe pain and joint inflammation because of the increasing deposition and accumulation of monosodium urate crystal into the joint due to the over synthesis of uric acid into our body, and that leads to severe joint pain and inflammation, that is called as GOUT or extreme arthritis or severe rheumatoid arthritis. So that was the simple introduction about GOUT. That is very important question for the 2 mark in competitive exam as well as in semester exam when it comes for pharmacology questions. Now we'll discuss about some drugs that can be used to treat GOUT. The drug which can be treated or used as a drugs of GOUT is NSAIDs. Which drug generally NSAIDs we can use? Indomethacin and diclofenac sodium. So in NSAIDs we can use indomethacin and diclofenac sodium. Second, we can use as colchicine as anti-GOUT drug. How it is going to show its action? By inhibiting the shift or alteration of neutrophils to the inflamed joints. So colchicine also is used to treat GOUT. How it is showing its action? It is going to show its action by inhibiting the promotion or inhibiting the alteration of neutrophil from the normal bones to the inflammation joint, so that no neutrophil can't go there and can increase the inflammation. It will going to reduce that inflammation by decreasing or inhibiting the going of neutrophils to the inflammation joint. So colchicine also can be used as GOUT, and it is generally or mostly used as anti-rheumatoid drug when it comes to treatment of GOUT. So for that GOUT, the main drug which is generally and frequently used in our daily life, that is colchicine. And also we can use prednisolone. How the prednisolone is going to work, that I have already discussed into the anti-rheumatoid drug mechanism. And fourth one is adrenocorticotropic hormone therapy. By taking supplements or injection of ACTH, we also can treat GOUT or extreme or severe anti-rheumatoid arthritis, means joint pain and inflammation in joint in case of old age person in geriatric patient. So by that I have finished up the topic of anti-rheumatoid drug, where I have discussed about the definition of anti-rheumatoid drugs, their classification, and mostly used drug like methotrexate and prednisolone and sulfasalazine, and their mechanism of action and dose required to take to treat arthritis as an anti-rheumatoid drug. Then we have discussed about what is GOUT, and at last we have discussed about the different drugs that is going to use in our daily life to treat GOUT, in especially in case of geriatric person or old age people. So today I have finished up that portion of anti-rheumatoid drugs in that today's class. In next class I am going to forward with that next classification of drug, that is drug acting on bronchial muscle. Especially we are going to discuss about the anti-asthmatic drug into the upcoming classes. So for today it is the end of our video, and next class we are going to discuss about the anti-asthmatic drug. Thank you.